The next point that you have to visualize that is that the risk factors of birth asphyxia based on acute fetal distress, the risk factors of birth asphyxia based on acute fetal distress are mostly risk factors that you're going to visualize on the ANC history and also on the labor history. Basically, so that's why your ANC, your antenatal clinic history, and your labor history is very important. Basically, in the antenatal history, for uteroplacental insufficiency, you may want to evaluate if there is was an infectious process that was taking place. Was she diagnosed of tortoise infection? Was she diagnosed of syphilis? All that may result to uteroplacental insufficiency. That may be an etiology of the birth asphyxia. She may have had malaria at the late pregnancy. All that may result to ischemia of the uterus, ischemia of in the placenta. That may result to the birth asphyxia. Is it clear? So those are the different elements that you have to visualize based on the ANC issue. Is it clear? So those are the elements that you have to visualize. You have to visualize if she was taking the health promotion of the ANC very seriously. Is it clear? Because there are certain elements like the intermittent prophylaxis for malaria. Is it clear? The intermittent prophylaxis for malaria. That intermittent prophylaxis for malaria, prevention therapy for malaria, actually help you to know if the woman was taking and if it is appropriate in order to reduce the malaria. So based on a labor history, you can understand labor history is mostly going to be actually with the pre-placenta and the post-placenta. Is it clear? For the post-placenta, you can also understand placental abruptio on the history. You can understand placenta previa on on this history. Is it clear? And you can also understand uteroplacental insufficiency, provided you have a prolonged labor, because uteroplacental insufficiency, I've forgotten to say that we have infection that was among, we have postterm, and we have also prolonged labor. Is it clear? Prolonged labor can also result to a uteroplacental insufficiency, that is reduction of the perfusion from the placenta to the umbilical cord. Is it clear? So when you have prolonged labor, is going to result to acute fetal distress via the mechanism of the uteroplacental insufficiency. Is it clear? So those are the different elements that you have to visualize. So that is on acute fetal distress, and then those are the risk factors of acute fetal distress. Is it clear? Of the risk factors of birth asphyxia based on acute fetal distress. So the risk factors of birth asphyxia based on acute fetal distress can come from the antenatal issue, if there is any infectious pattern, if there is any infection in the antenatal issue, or it can come from the labor issue if there is prolonged labor, which can tell you that there is uteroplacental insufficiency, or you can have signs of the third trimester bleeding, which may tell you if there is a placenta previa, a placenta abruptio, or a vasa previa. So those are the different elements that you have to understand. Now, after understanding the risk factors of birth asphyxia based on the acute fetal distress, you're now going to explain now the pathogenesis of birth asphyxia based on the fetal abnormality.